This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh, where we're going to be speaking with Dan Dukic. Now, he is a nurse practitioner in the GI department along with Dr. Jeff Goldman. We're going to be talking about a subject that many of you may have never heard of before, but it may provide a lot of relief for those suffering from C. diff. Well, Dan, thank you for taking some time to talk about this today. Now, you have many different options for people suffering from gastrointestinal issues, and today we're talking about a specific intestinal therapy.
Mm-hmm. And it is called intestinal microbial therapy, or what we refer as to IMT.
Okay, and tell us what exactly that is.
Well, intestinal microbial therapy is basically a concept of using stool from a healthy donor, which is transferred through colonoscopy or several different routes into actually gastrointestinal tract of a sick person. So it's not a new concept. Basically, how it works, it's the idea of basic bacterial transference, so that, or what I call bacterial interference, basically the use of healthy bacteria which basically pushes away the pathogenic bacteria in someone's intestinal tract. And at this time, we're solely using it to treatment of recurrent C. difficile infection.
For people that are not dealing with the pain and discomfort of the intestinal problems, when you talk about this therapy, what is the reaction to people, and what do you tell people that it actually helps?
Well, usually, of course, you get anything from laughter to puzzle to, almost shock and disbelief, because, it's such a basic concept, but of course people don't necessarily, work with this. And, unless you've done your own research, which most people who have recurrent C. difficile infection, they have. Most people that I talk to who have this problem, they already know about it, they've done their own research on internet, and so they're a little bit familiar. As for the rest, that's basically for general public, most people are still unaware. Again, it's almost, it's still fairly experimental procedure, actually.
Yeah. How effective has the procedure been for those suffering?
Okay, it is highly effective. The data that we gathered from FDA sites and basically most evidence-based resources, we're finding out that numbers are different, but basically anything between 92 to 94%. So we're taking about 93% success rate.
Now, who would be a candidate for this therapy?
The candidate for this therapy would be any patient or any person basically that suffers from recurrent C. difficile infection, meaning someone who already had underwent several courses of antibiotic therapy. They typically get vancomycin or flagyl or ciprofloxacin, several different antibiotics. So anyone who has failed several courses of antibiotic therapy, anyone who is still presenting with symptoms congruent with acute C. difficile infection, which is watery, diarrhea, runny stools, cramping, and fever, and somebody who we know for sure who had C. difficile infection confirmed, via testing or colonoscopy.
Sure, and there are other medicines, therapies that are available. Where does this come down the line? Is this towards the last resort?
It is a sort of last resort, absolutely. It probably would be the best way to put it. So basically, when someone has been diagnosed first time with a C. difficile infection, and which is unfortunately it's getting more and more prevalent, not only in the hospital settings, but in the communities in general. So someone who has been diagnosed with a C. difficile would typically be started on the course of appropriate antibiotic, typically vancomycin. And after the first time this person gets sick with C. difficile and is treated with vancomycin or antibiotic, there's about 20 to 30% chance of this recurring. After the second recurrence, basically this number goes up to 60% or above. And basically after the third recurrence, it's simply impossible to eradicate this organism with conventional procedure, conventional treatment, which is antibiotics. Mm-hmm. So after the third recurrence, there's really no other options. These persons are typically colonized for life, and antibiotics sort of, just patch the fire. They can just treat them, for the time being, but they don't really eradicate the organism anymore. And this is where the intestinal microbial therapy comes in place.
Okay. Then one of the questions people might have then is where are there donors for this therapy then?
Absolutely. And again, being it's a fairly new, in a way, still experimental procedure, the things that we found with studies is actually that anybody who is a healthy donor, any healthy donor, person in a fairly good health can be a donor. So that's typically adult child, sibling, spouse, or significant other, or even actually a healthy friend. So we actually had people like that who have friends who have healthy bowel movements or healthy gastrointestinal tract that actually can be donors. Mm-hmm. So anyone who has good gastrointestinal health and no history of irritable bowel disease or even irritable bowel syndrome.
Yeah. Dan, there are other things that this can potentially help as well.
That is absolutely correct. Right now, again, this is the only treatment we're doing. At this moment, we're only treating recurrent C. difficile infection, but there's a lot of potential, a lot of new research and studies that show that intestinal microbial therapy may be actually really beneficial in the near future for the treatment of irritable bowel disease, such as Crohn's disease or ulcerative colitis, but also other things such as irritable bowel syndrome, even autism, and actually there's a lot of new studies talking about potential benefits in the weight loss. So I think as the time goes by, we'll be seeing a lot more research done in this regard, and ideally, probably 5-10 years down the road, we'll be able to use intestinal microbial therapy for these concerns as well.
What's the best way if a patient has been suffering with this for affliction for a while? What's the best way to begin this process and find out more information?
Absolutely. For anyone interested, we can send information through their primary care providers. That usually would be the best way, but we do accept direct referrals, so patients can contact directly Aurora Medical Center, Oshkosh, our gastroenterology office, and we can provide them with information. We would mail them first information, and then if they're still interested, they can bring a potential donor who basically I would meet with a potential donor and a patient or potential recipient, and then I would talk about this procedure in a greater detail with them.
Okay, well, we appreciate you taking some time and sharing that information with us today.
Sure, thank you very much.
Now, if you're dealing with C. diff or any of the other intestinal issues that Dan talked about, this might be the right therapy for you. If you have questions, you can give Dan or Dr. Goldman a call in the GI department, or of course, you can always talk to your primary care provider. Give us a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.